We are good to go.
Alright, so my name is Betty Okere. I am a nutritionist and a diabetes educator, and I specialize in helping patients work out their diabetes and being able to control their blood sugars, as well as live a very healthy and affordable life even though they have been diagnosed with diabetes. My prayer and hope usually is that we can be able to save someone from having a diabetes-related complication and even death as a result of diabetes. So today I will take time to try and answer some of the questions that you asked from our social media pages, and especially the Kenya Diabetes Support Group. One of the questions, I think it's from someone by the name Richard Esuba, and he asked, I have recently been diagnosed that I have diabetes and I have a wound. Can honey be used for treatment of diabetes? Whereas previously, like before the age of medicine, people had used honey and other non-conventional methods to treat wounds. The fact that you already know that you have diabetes should be a wake-up call to have you go to hospital and just check what your blood sugar levels are like. What is the cause of the wound? Is it more than just a wound? Would it be a problem that is touching on the nerves or the vascular system? And how can that be sorted out? So it would not be, I would not really advise you to start using honey on that wound, but kindly request that you go to hospital and have your blood sugars managed. Another question that has been asked here is, do you know which type of diabetes you have and which type has less sugar? Does low sugar mean your diabetes is different? And must one eat a lot of carbohydrates or sweet drinks to all the time to curb it? All right. So when you have diabetes, you could have several types, but maybe now I want to concentrate on just 3 common types. So the first one will be gestational diabetes, and usually we detect gestational diabetes in pregnancy. So what does that tell you? It can only be in women and only in pregnancy. This type of diabetes tends to disappear or get resolved when the mother has delivered, and so we'll have a repeat test after 6 weeks of delivery and several follow-ups to just confirm that the mother was actually not diabetic. It is only the pregnancy that pushed the body to have what we call gestational diabetes. However, there are instances when somebody is pregnant and you realize that they have high sugars, but they had type 2 diabetes and they didn't know about it. Why? Type 2 diabetes is pretty silent, and you might not even get the symptoms or the signs of diabetes, so you might not know. So to rule out that, we'll have to check with the mother, follow up after they have delivered to see if the diabetes is there or it's not there, and carry out some other tests like oral glucose tolerance test to see how is their body able to deal with an excess of food or an excess of sugar at any given point, and several other tests just to confirm. And then the last common type of diabetes is type 1 diabetes, and usually we see this in children and young adults, and it's something we'd like to call autoimmune disease. Why is that? We really have no idea what causes it. It's just like the body trying to fight itself. So it is the antibodies maybe produced after a certain bout of a disease, which is non-related to diabetes, attacking the pancreatic the insulin making cells in the pancreas, and that destroys them and removes the capacity of the pancreatic cells to secrete any insulin. It can get any child. Usually if we have a child who has got parents with diabetes, they are at a higher risk, but it doesn't mean they must be diabetic. It can actually get any child. So those are the most common types of diabetes, and the other types of diabetes that may exist, we probably want to talk about them if somebody is suffering from them, so that we do not bring a lot of confusion. I want to look at another question here. Somebody says, my mom is diabetic and has been using brown meals, but complains that has constipation, if I got that correctly, because she's complaining of her haja kubwa. So I think has constipation. I've been asking if there is unga in the supermarket. I will not touch the brand. which is good for her because she's up country? Please tell me. When somebody is diabetic, I know this is a support group and we're trying to support each other and we're trying to learn from each other, but we need to understand our bodies. Maybe what is happening to this particular patient is the fact that they may be eating the highly loaded fiber ugali, the brown ugali, maybe lots of it, and then they don't have exercise, they're not walking, they're probably just sedentary, they're not drinking their water, their vegetable intake to ensure that we have soluble fiber also present is probably not adequate. So this is not a question that we would want to answer at this point, because it might be a very different cause. It's not, we can't rightly say that it is the brown ugali that is causing her constipation. There could be other reasons. Maybe even her bowel movement practices are not good. What do I mean when I say that? There are people who will feel the urge to go for a long call, but will stifle it. They will not go, all right? Or they will not go at the same time every day. That makes your body not be able to know really at what point do I need to move bowels and at what point do I need not to, all right? So that is something that we have to check. So yes, as much as we are trying to look for which unga might be the best, as long as you have wholemeal. Whole does not necessarily mean brown. We all live in this country and we know that sometimes to entice people to buy what we are selling, we might end up coloring the food and lying that it is wholemeal. So wholemeal, meaning it has not been excessively processed. This is not to confuse processing with only what has been packeted. But by the fact that we are grinding this millet or this sorghum, it has already gone through some processing, right? Only that it is not excessive. We have not removed some nutrients and parts of the food to polish it. Okay, and I'll ask another question, maybe answer this one. Hello everyone, what do you do when your sugars are high but you took insulin at the right time and you had a balanced diet for dinner? Several factors will actually affect your blood sugar. What is your stress level like? All right. Yes, you had a balanced dinner. What do you mean by a balanced dinner? You see, balance simply means you have got all the components of your nutrients available on your plate. But you could be having all your components available, but the carbohydrate content was high, and that has got the highest impact on your blood sugar. Or before you went eating your food, probably you had stayed too long without food and your body decided through glycogenesis to give you what? Give you sugar. Or maybe you took the right amount of insulin, but according to the previous practices, that dose that you have been given is now not able to satisfy the control of sugar or satisfy the requirement of the body in terms of how much insulin does it need versus how much sugar do you have. So again, lots of factors there that we need to look at. Or one that we never look at, what is the potency of the insulin that you're using? All right. Have you denatured the proteins in your insulin? I know people who take insulin instead of rolling it on their hands to mix it or gently rocking, they shake it like syrup, all right? Or the storage of this insulin, how have you stored the insulin? Have you checked to ensure that it has not gotten to expiry date? So several factors. So before we say maybe that insulin is not working, we need to check on all those factors and see what we can adjust based on that. And somebody says, I am from hospital and my random blood sugar is at 8.7. Am I okay? Pretty difficult question to answer because we have different criteria for diagnosing diabetes. If this patient had come to me and their random sugar was 8.7, I would want to send them the next day for a fasting blood sugar. This would be after I have asked them a few questions about what is their family history of diabetes, what is their height and weight, what is their BMI, do they seem to have accumulation of abdominal fat, are they at risk of diabetes because of the family history, maybe it is a strong family history of diabetes, what is their age, and then on top of the fasting blood glucose, probably send them for a simple test like the oral glucose tolerance test. Have the blood sugar checked before they eat anything. Have it checked after 1 hour of ingesting glucose, 75 grams of glucose, checked again at 1.5 hours and checked again at 2 hours. so that I check that against the diagnosis criteria for diabetes to just confirm that they're diabetic or not. And of course, whatever the case, if they are diabetic, then I would send them for an HbA1c test to just check what that is. Another one says, my child is 13 years old, diagnosed with diabetes type 1 in January 2019. And the next person says, hi friends, really what is the difference between type 1 and type 2 diabetes? So I think these two questions, I will handle them together. We diagnose diabetes in children, that is diabetes type 1. And it has got a trend. Usually it will be at preschool, you know, that age 4 to 5, or very early, you know, before the age of 1. And then we have another diagnosis at teenage, and another diagnosis at late teenage, you know, 19 there, going to 20. And sometimes we will also have it at around 30, 29, 30 years before they get to 35. Okay? Now, does it mean that it is uncommon to have type 1 diabetes outside these ages? Not really, but that is when we are seeing the trend even more. What is the difference between type 1 and type 2? I had tried to mention it earlier. We are seeing type 1 in children and young adults. We are seeing type 2 in adults, usually above 35 years of age. And if you look at a type 1 diagnosis, the person or the child will not have issues with excess weight. It will be very acute. So within a very short time, maybe a month or 2, we have known that this child has got diabetes, and the signs and symptoms are quite severe. You know, they might be having the urge to pass urine so many times, or if it's a child who has stopped urinating on the bed, they might be back to it. Then maybe they're eating polyphagia, they're eating so much, all right, they're always hungry, and usually they want foods that are high in sugar, all right, and they're losing weight at the same time. For some children, it would be they're having stomach aches, diarrhea, they are vomiting, and you know, stomach pains, they are lethargic, they're always in a bad mood, they are fatigued, they always just want to sleep, and drooping eyes, and several other symptoms related to diabetes. And if you take this child to the hospital, sometimes they test and they cannot find any other disease, because this would be atypical of what you see in typhoid or malaria, but you test for all the things and you're not able to see that. So then if you check the blood sugar, you might actually find that the blood sugar is high. As I had said earlier on, this is autoimmune. We do not know the exact cause of type 1 diabetes in children. And then the type 2 diabetes, as we spoke about, is in adults usually. Now we are seeing a trend with a few children having type 2 diabetes based on their lifestyle, but it is something that we commonly pick in adults. You will see lifestyle disease, lifestyle complications like obesity and overweight. You know, somebody has got more weight than they need. Abdominal obesity, we'll also see that. Then we will have usually an older age, so sometimes maybe somebody is not really obese, but they have an advanced age. If you check the family history of diabetes, you'll find that such people usually have a strong family history of the disease. And some people will argue and say, you know, well, I have checked with my family and I have never heard of somebody who has diabetes in my family. I would not be so quick to conclude that, because we all know as Africans we have this habit of not telling our relatives what we suffer from, and that can make our relatives not know that we have diabetes. So when they ask that question, they might not be able to know what to answer. And then somebody says, please make for me a simple menu that I can follow for a week to ensure that I lower my blood sugar. This is not the way I would go, really. If you know you have diabetes, just go to hospital, check with your doctor, let them tell you at what point you are, let them tell you what medications you need, and then ask them to send you to a qualified nutritionist, all right? So that we work with what is affordable to you, what is available to you, and what is acceptable to you. Alright? That way, you will also be learning what foods spike your blood sugar, at what amount, at what times, and what to do about them. We can't sit somewhere and say, you know, my friend used this meal plan and I'm going to use it. It is going to work for me. We recommend very individualized management of diabetes, and that goes to all aspects of management of diabetes. So we have no best diet, because what works for you might not work for your mom who's diabetic, might not work for your friend who's diabetic, might not work for a friend of mine who is in Garissa and probably may not have, as an example, may not have all the meals in, may not have availability of 3 meals in a day, or for somebody who has got very poor feeding habits and may not be able to eat the 3 conventional meals in a day. So it is what works for you based on availability of food, affordability of food, and acceptability of food. So that we do not go saying, you know what, you all can eat meat, because yes, meat does not raise your blood sugar. But what if I'm allergic to meat? What happens in that case? So I really advocate for you to seek professional help and work out that menu with your nutritionist and follow it through and see what further works for you and at what level. And I think the last person asked, hi family, is mixed shot given on a 12-hour duration, and if I have a shot at 7 a.m., should the next shot be at 7 p.m.? Now, insulin is one of the treatments that we use for management of diabetes. And again, I say this is very individualized. Whereas your doctor may give you an insulin injection mixed, for example, 2 times per day, and I'm not saying mixed because this is the only insulin that is available, it's because this is the question that was asked. Sometimes your doctor may decide, let me give you 2 injections per day, or let me give you 1 injection per day. If I give you 1 injection, it basically means in 24 hours, you should only have injected once. If it is 2 injections in a day, in 24 hours, you should only have injected, 2 times. So adhering to your medication timings would be very important, so that you're not, for example, injecting this insulin 2 times and you take your first injection at 7 and 18 hours later is when you're taking the next injection. Your medication would have run out and the body would be running without support. Or somebody decides, I'm taking my first shot at 7 a.m. and because I want to sleep at 4 p.m. or 5 p.m. I take the next medication. There would still be some tail of this medication lagging on in your system. What does that mean? It makes your body feel like the next injection that you've taken is actually an overdose. So again, let us all adhere strictly to our medication times. This is not just for insulin, this is for all the other medications that we're taking. For example, if you're on a tablet and the doctor has clearly indicated that you need to take this tablet with your food, you know, right in the middle of when you're eating. So you start eating, take your medication and continue, you should do exactly that. If the doctor says take your medication 10 minutes before your food or half an hour before your food, that is exactly what you should do. So what are we doing here at the Diabetes Management and Resource Center? We are trying to reach that population that ordinarily would not have access to medical care or professional care. Maybe somebody, for whatever financial reasons or distance, they're not able to afford proper care, right? So the facility has subsidized some of these costs to the patient, so that you're able to get nutrition counseling, you're able to get nutrition education, you're able to get diabetes education, you're able to get consultancies with several other healthcare providers at a subsidized cost, and sometimes even free. So we cover our costs to be able to give you that information that you so require. So every Saturday, that will be began last Saturday, that is on the 5th of September, and subsequent Saturdays, we will be holding free nutrition education, diabetes education and consultancy services at the DMRC Center in Gara, and that will help us to reach that population that would not, however, be able to access proper care. So take advantage of that, please. Visit the center and have your evaluation done. If there are any medications that you will need, then the right professionals will be able to prescribe that for you. There will be a doctor to be able to prescribe that for you. If there is management based on diet, then again we'll be able to follow you up. Remember, no one size fits all, and so we will work with the individual to see what works best for them. Thank you very much, and hoping and looking forward to seeing you every Saturday between 9 and 1 o'clock at the Diabetes Management and Resource Center in Ngara. Asanteni sana.